Good morning, everybody. We're here today to continue our discussion, even as we launched our online program of My Dad MD. My name is Akin Fajolu. As we launched the program, we declared health for all, as we believe that health is wealth. No one can claim to be worthy without being in a good state of health. So important and is so key for us to discuss the matters of health. We started on the 7th of January 2024, and we attempted on that day to define health. As we mentioned, we have decided to embrace the WHO's definition of health, which states that health is a complete state for physical, mental, and social well-being, and not merely an absence of disease or infirmity. We went on to describe the various levels of health care, as in primary, secondary, tertiary, and quaternary health care. We also went on to talk about the various levels of prevention of diseases, as in primary, where there is involvement of the government, the involvement of individuals, and the involvement of communities as a whole to prevent the onset of disease. We went on to secondary level of prevention, which hammers on the early detection of disease and prompt treatment, because this geared towards reducing the impact of disease. And the tertiary level is about rehabilitation. This softens the impact of diseases. People who already have an ongoing disease, things that are put in place by rehabilitation, so that they will not feel the impact of these ongoing diseases. So we went on and launched and declared war against the silent killers in the last episode. These silent killers, as we said, they are conditions that goes on within our bodies that we were not aware of, because they do not present with any signs or symptoms that will prompt us to do something about them. So such conditions, as we highlighted, includes hypertension, it includes diabetes, it includes cancers, it includes osteoporosis, some other ones, but these are the key ones that we are emphasizing and we're going to be talking about. So as we are here today, we are starting to talk about in details about hypertension. So we need to pay attention, because this information is going to be helpful, so we'll be able to know how to recognize hypertension and what to do about it, so that we can live a healthy life. We are starting today by talking about the burden of hypertension worldwide. It's been documented from several data, especially that from WHO, that among the people of 30 to 79-year-old, about 1.38 billion people are suffering from this hypertension. And about half of this population are not even aware that they have it. Among the people who are aware, 1 out of 5 are getting care, and to the extent that their blood pressure is controlled. So we can see that this is important and that we need to know, because many situations people carry these conditions without their knowing it. So that's why we need to wage a war against the silent killers. We have to start by exposing them, and we need to restrain them so that we can live a long life. So to talk about hypertension, we need to start with blood pressure. Hypertension is often and generally referred to as high blood pressure. But we know that high blood pressure is a sign, it is not a diagnosis, while hypertension is a diagnosis. Diagnosis of hypertension is made by your provider. However, we, and as a group, we could make efforts to take our blood pressure using the devices at home, but the diagnosis has to be made by a provider, be it your doctor, your nursing practitioners, or your physician assistants. Your healthcare provider needs to make a diagnosis, and this diagnosis is not made by just one blood pressure reading. It has to be elevated consistently and persistently on more than one occasion before a diagnosis is being made. So what do we call blood pressure? Blood pressure could be described as that pressure that our blood exerts on the walls of the vessels as it flows through them. To simplify it further, as our heart pumps blood out into the vessels, this blood exerts some pressure on the walls of these vessels. There are two major types of vessels. We have the arterials and the venous. The heart pumps blood into the arterials, while the venous takes the used blood and return them back into the heart. So the pressure that is being exerted within these arterial vessels are those pressures that we call blood pressures. So situation where this pressure is elevated consistently, we refer it to as hypertension. The diagnosis of hypertension, like I said earlier on, has to be made by our providers, and it's based on two measurements. We refer them as systolic, which is the upper number, and the diastolic, which is the lower number. The systolic is the pressure exerted when the heart pumps out blood into the blood vessel. That is after contraction. While diastolic is the lowest blood pressure that is measured in these vessels when the heart is relaxing. So diastolic is a measure blood pressure during relaxation of the heart, while systolic is a measured blood pressure while the heart is contracting and is pumping blood out. So the blood pressure, which has an abbreviation of BP, is a measure of systolic and diastolic pressure. Sometimes we do hear things like 120 over 80, 130 over 80, 140 over 80. These figures depicts the blood pressure as we have it. And the unit is surely millimeter mercury. So a lot of time we don't have that. We just say it's 140 over 80, 120 over 80. The benchmark for definition of high blood pressure has been reviewed over the years. Generally speaking, we're going to be using 140 over 90 as a benchmark today. Anything from 140 over 90, be it systolic or diastolic, we are regarding as hypertension. Many experts have brought this down to 130 over 80. That means anything above 130 and anything above 80 could be regarded as hypertension. But we just want to narrow ourselves down to 140 over 90. Wherever it is taken once and you get this figure, it has to be repeated on a different occasion before we make the diagnosis. So we are going on to describe what are the symptoms. Like we said, high blood pressure has no specific symptom. However, there are risk factors that we look at that could enable us to suspect this condition in individual. There has been association with some risk factors which we could classify as modifiable or non-modifiable risk factors. I will quickly mention the non-modifiable risk factors. These ones include our age. The more we age, the higher the risk of having high blood pressure. That does not mean that every old individual will have high blood pressure, because it's an interplay between factors or risk factors. So apart from age, we also talk about our genetics. Some people have a family history of high blood pressure. The incidence or prevalence is relatively higher among people with this genetic predisposition. These risk factors are non-modifiable. There is nothing anybody can do about them. But it's more important for us to dwell on those things that we could do something about. And these are the factors we refer to as the modifiable factors. These modifiable factors includes like our diet, high salt intake diet, fatty meals, high cholesterol. All these can impact the environment of our system and predisposes one to high blood pressure. Lifestyle. What kind of lifestyle do we have? Sedentary lifestyle with no physical activity. This can also predispose us to high blood pressure. No exercise. Sitting down in one place for too long is a high risk factors that needs to be managed. Our body weight. People who tend to be obese or morbidly obese, they have a high predisposition to high blood pressure. Obesity, using the benchmark of the body mass index, which we call BMI, starts from 30. The morbid obesity starts from 40. So we need to do a lot about controlling our weight. So much today, many efforts, and there's a lot of awareness about weight loss programs, starting from your diet management, from the use of lifestyle modification, like taking doing exercise, simple exercise as in brisk walk, maybe 3 times in a week for 30 minutes to 1 hour. Is going to be useful as a form of exercise. And today, people even go further. They talk to their providers about any justification for medication. These medications have been helpful to some people. Medications could be tablets. They could even be injectables. There are a couple of injectables these days that are out there in the market that, without mentioning their names, the provider will make an intelligent options that will fit your need. So we need to talk to our providers and talk about the concern about weight so that we can live healthy. So that's about our weight. So many other factors, like some people who had a previous history of stroke, is a factor that has to be looked into, because hypertension has been linked to incidence of stroke. And there's also associations with some other medical conditions like diabetes, high cholesterol, that needs to be looked at. Incidence of hypertension is also associated with the incidence of heart attack, myocardial infarction, because hypertension is number 1 risk factor as causing myocardial infarction, which we often call heart attacks. So all these factors, we need to consider them and manage them accordingly, so that we will pay attention to any suspicion of high blood pressure and do the needed to control and mitigate it from getting worse, because a lot of complications has been associated with hypertension, be it the eyes, the brain, the kidneys, the vessels, the nerves. There are so many of these, and the heart itself that has been associated with hypertension. We don't want to get there. But the important thing is that once this is diagnosed, we have the privilege of getting it under control. Once it is under control, this morbidity, the comorbidity, the risk will be low. So we'll be able to live an healthy life despite the diagnosis. Because once it is diagnosed, the label is there. We could only say that it is well managed or it is not well managed. So we need to put a situation where we will manage the blood pressure accordingly. It has always been said that high blood pressure are of two types. There is the primary hypertension, which is what we have been dwelling with. That is also referred to as essential hypertension. That is the hypertension that you don't know the cause. It's just there. We cannot associate any cause to the hypertension that is primary. Secondary hypertension tends to affect younger people. That is curable. That could be attributable to a condition within the system. Most likely the kidney. Once the kidney problem is dealt with, or the primary cause is dealt with, that hypertension will be cured. That is why it is called secondary hypertension. However, primary hypertension is not curable. It could only be manageable. So we need to discover it on time and manage it accordingly. And when it is well managed, the risk of the complications that is associated with high blood pressure will be minimized, and we will live our life and live as long as God wants us to live. So that's about hypertension. As we go on in our next episode, we dwell more on some of these silent killers so that we can mitigate it. We can get it on time and get rid of it from our system, from our individuals, from our communities, and the world at large. So I'm very excited about these discussions, and I pray that we pay attention and likes it as we see it, share it to other people so we can go as far as possible. Follow us as we go along, subscribe to it, and we'll be happy to see you again next episode. Thanks for listening, and God bless. Thank you again.